Hello and welcome. My name is Heather Hall. I'm a registered dietitian and a certified leap therapist, and I specialize in teaching you how to beat chronic disease and eat your way back to health. This video is intended for my clients who are starting week 2 of their 4-week Jumpstart in preparation for their LEAP protocol. So if that sounds like you, you're in the right place. Week 2 is all about balancing blood sugars. But before we talk about that, let's just take a moment to recap week 1. There's a spot in your workbook for this. Be sure to jot down some notes about how week 1 went for you, because I would love to hear about it in our next consultation. Let's dive into balancing blood sugars. So if you are coming into this program knowing that you have prediabetes or diabetes or polycystic ovarian syndrome, or perhaps you know that you struggle with low blood sugars, then you might be excited for this week. But if you don't have one of those conditions, you might be wondering how this information is going to pertain to you. Let me explain. So, blood sugar balance is intimately connected with something called insulin resistance. And insulin resistance is the most common condition worldwide. More than half of Americans have it, so the odds are that you do too, especially if you're already battling some chronic conditions. Insulin resistance is the cause of or plays a huge role in a host of chronic diseases that you probably are not aware of. So listen to this list, and this may relate to you because a family member is affected by this condition, or it may be you personally. Insulin resistance contributes to cancer, heart disease, Alzheimer's, diabetes, low testosterone in men, polycystic ovarian syndrome in women, infertility, fatty liver, sarcopenia, migraines, osteoarthritis, stroke, dementia, and increased body fat. So you may be wondering, what is insulin resistance? Let me explain by first telling you what insulin is. So insulin is a hormone that's made by your pancreas. It's released into your blood in response to rises in your blood sugar. So when you eat anything with carbohydrates in it, carbohydrates are actually sugars or long chains of sugars. So white sugar, brown sugar, syrups, honeys, all of those kind of simple sugars that you would first think of, those require very little digestion and are absorbed very quickly into the bloodstream and make your blood sugars rise. Also, if you eat fruit or milk, those contain natural sugars in them that are also absorbed pretty quickly and easily by your body and will cause your blood sugars to increase. If you eat anything with starch in it, like potatoes, corn, grains like rice and wheat, those all contain starches, and starches are actually just long chains of sugar molecules that your body will then break apart using enzymes, and you'll be able to absorb the sugar molecules, which will cause an increase in your blood sugar. Now, your cells need those blood sugars in order to provide energy for the cells. And so when blood sugars rise, then insulin is secreted, and insulin signals your cells, hey, there's some extra sugar here in the blood. Why don't you take that up and you can store it and use it for energy when you need it? Fiber is also a long chain of sugar molecules. The difference with fiber is that your body actually does not contain the right enzymes to break fiber apart into those individual sugar molecules. So fiber cannot be absorbed, and it does not make your blood sugars rise, even though it is a carbohydrate. Keep in mind that when you are getting carbohydrates or sugars in your food from real whole food sources as opposed to treats, it's going to affect your blood sugars differently in general. So if you're eating candy or cookies or soda pop, the sugars and even the white flours in those are very simple, very quickly digested and absorbed by your body, and it's going to make your blood sugars rise quickly. If you're getting your sugars from things like fruits and vegetables and milk, there's also going to be a lot of chewing and biting, first of all, involved, so you're going to be eating the food more slowly. They're also going to contain less sugars overall in general than something like candies or sodas, and so you're going to be getting less sugars that way and less of a rise in blood sugars. And then also, those foods are going to, in general, contain a lot of fiber and fats and proteins, all of which slow down the digestion and absorptions of sugars, which are going to make your blood sugars rise more slowly. One caution here is when you're getting whole foods in the forms of smoothies. So smoothies can be a great way to pack in a lot of nutrient-dense foods, but if they're not made with a balance of carbohydrates, proteins, and fats like we're going to talk about in this video, and if you're drinking them very quickly, then that is also going to cause a quick rise in blood sugars, which we are wanting to avoid. So my advice with smoothies would be to make sure that they're balanced and to sip them slowly. So you eat a little sugar, so now what happens? So that sugar is going to be absorbed into your bloodstream. It's going to cause your blood sugar levels then to rise, and your pancreas is going to respond by secreting insulin so that your cells will take up that blood sugar into the cells, and blood sugars will be able to go back down to normal levels. Normal for most people is between 80 and 99. That's where your body likes to keep your blood sugars. For thousands of years, our ancestors have had diets that are fairly moderate in carbohydrate for the most part, and very low in simple carbohydrates and sugars. And when they did have things like that, it was in the form of natural sugars from fruits, maybe honeys, when it was in season or available. And so our bodies really aren't programmed to handle large amounts of sugar all at once. They don't know how to respond properly. The problem with the standard American diet is that we typically eat copious amounts of sugar all day long, and this causes problems in the body. High amounts of sugar or even carbohydrates all day long equals high blood sugars throughout the day. High blood sugars throughout the day equals high amounts of insulin throughout the day. And high amounts of insulin in your blood chronically is going to cause your cells to become insulin resistant, because the more insulin that they're exposed to and that's floating around all of the time, the less they respond to it. And so where it used to take only this much insulin from your pancreas to get your blood sugars normal again, now your cells are resistant. So now it takes this much to make them respond appropriately. And because there's more insulin floating around in the blood all the time, now they are becoming resistant even more. So now it takes this much insulin to get them to respond, and on until insulin levels can become quite high all of the time, and your cells can become very insulin resistant. This is the point at which we start to see it affect blood sugars, where the cells are so resistant to insulin that no matter how much insulin your pancreas is pumping out, those cells are no longer responding and taking up the sugar from your blood. That's where we end up with high blood glucose levels, and we call that prediabetes or diabetes when it gets high enough. So for years before you are ever diagnosed with diabetes, your insulin levels will be high. The problem is that we don't typically test for insulin, we just monitor blood sugar levels, and so we don't catch it until it's already a major problem. Pretty much everybody in America is riding what I like to call the blood sugar roller coaster, where it's just where our sugars are spiking really high, and then insulin spikes really high and follows, and pretty much over responds because we're not programmed to handle those high amounts of sugars. So insulin over responds and causes blood sugars to dip down very quickly and sometimes too low. At that point, you're going to be craving more sugars. And this is why sometimes even after you feel like you've eaten a good meal with plenty of calories in it, you might feel hungry again only an hour or two later because you're riding the blood sugar roller coaster. Let me show you what this might look like for a typical person. So you wake up in the morning and you're hungry, your blood sugars are low, and so you eat what you would consider a healthy breakfast. So you have your bowl of cereal and you want to have some whole grains, so you do some frosted mini wheats, right? So you pour your bowl of frosted mini wheats. So the serving size on the box of mini wheats contains 46 grams of carbohydrate. Now 6 of that is fiber, and so we'll subtract that out because your body can't absorb the fiber, so it's not going to affect your blood sugars, right? So you're getting 40 grams of carbohydrate that you can absorb. And because most people usually eat more than what the serving size listed on the box is, we're going to double that. So you're getting 80 grams of carbohydrate with your cereal. Now you're going to add to that a cup of milk, of course, and that will add 12 grams of some natural sugars. And you want to get your fruit in, so you add a cup of orange juice, which will contribute another 20 grams of sugar. They are natural sugars, but they're very simple and easily absorbed, especially from juice, because there's no fiber or chewing or any sort of breakdown that needs to happen there. So this brings your breakfast to a grand total of 112 grams of carbohydrates, which will all be broken down into sugars, 27 grams of protein, and 1 gram of fat. That makes your breakfast 79% carbohydrate with only 19% protein and 2% fat. You're getting 565 calories from this breakfast, so that's a pretty good calorie amount for a breakfast. Very reasonable. But because there's so much carbohydrates that are going to make your blood sugars probably spike pretty quickly, followed by an insulin spike and a blood sugar crash, you're probably going to feel hungry pretty quickly after this breakfast, even though you got sufficient calories. Now, because your blood sugars have dipped low in an hour or two, you're going to be craving sugary things because your body feels like it needs more sugar. And so you might eat a bagel or a muffin or some other sweet thing or carbohydrate food. And this is going to cause you to jump back on that roller coaster with another high and another low. And this is probably repeated throughout the day at most meals for most people. That's the standard American diet. So riding the blood sugar roller coaster results in chronically high insulin levels in the blood, which results in the insulin resistance. Now, if insulin's only job was to tell your cells to take up insulin, it probably wouldn't be that big of a deal if it was high all of the time. But it's not insulin's only job. Insulin is a hormone. One hormone in the body doesn't act in isolation from the other hormones. They can all affect each other. And so when you have a hormone that's chronically high like insulin, it may start affecting other hormone systems in the body as well. And that's where you might end up eventually with the low testosterone in men, or infertility or PCOS in women. Along with it might start to affect your thyroid or other systems in the body as well. Another important role for insulin is that it actually signals your fat cells to store up more fat. And so when you have high insulin in the blood all of the time, those fat cells are being signaled to store up a lot of fat. So that can make losing weight really difficult for somebody with insulin resistance until it's corrected. It can also be a cause of non-alcoholic fatty liver disease, which is becoming a huge problem, and this is one of the reasons why. Another problem with insulin resistance, when it gets to the point where your cells stop responding and your blood glucose levels become high, is that very high sugars in the blood are really hard on the body. Just think of all of that thick sugar floating through the blood. It's very damaging to those vessels and the nerves and the organs that it's flowing through all day long. And so that is where a lot of the dangerous complications of diabetes come from, is from the very high blood sugars doing damage in those vessels and nerves. The crazy thing is that we treat diabetes, which really is more of a problem of high insulin than it is of high blood sugars at the core, right? The high blood sugars are more of a symptom of the insulin resistance, but we treat diabetes often by giving more insulin. The sooner that we can get you off the blood sugar roller coaster, the better. So what we're going for in this program is nice, gentle highs and lows in your blood sugars, and we want to be avoiding those spikes in sugars and insulin. Realize that if you've been riding the blood sugar roller coaster for a long time and you have insulin resistance developing, it may take time for things to normalize again. So just continue to follow the plan, eat the healthy diet, follow the principles you're about to learn, and give it some time. Your body knows how to create health when it has the right circumstances. So just be assured that you are doing that for your body and be patient. I'm going to give you 4 tools to help you balance blood sugars and overcome insulin resistance. So tool number 1 is called PFC times 3. So PFC times 3 stands for protein, fat, carbohydrate, 3 meals a day. And you are also welcome to add snacks in there if you need them. So part of having nice, gentle ups and downs in our blood sugars is to make sure that we're eating at regular intervals. That's why I want you to be getting in at least 3 meals a day, snacks as needed, and at each of those meals, you are going to make sure that you include your PFC, a protein, a fat, and a carbohydrate. By doing this, you are allowing those carbohydrates to be broken down and absorbed more slowly. And so that is going to affect your blood sugars more slowly. When it comes to your snacks, make sure that you're including at least 2 of the 3 PFCs, especially if one of them is a carb. Be sure to pair it with at least a protein or a fat at snack time. Tool number 2 is the plate method or the rule of thirds. You'll see in your workbook an example of the plate method in there, and you'll fill it in. So do this along with me. One of those sections is for your protein foods. So go ahead and write that into the plate. Another section on there, another of the thirds, is going to be for your carbohydrate foods. And the third large section is going to be for vegetables, non-starchy vegetables, right? Because the starchy ones are going to go in the carb section. The circle in the middle is for the healthy fats. And that is because I don't want you to forget to include healthy fats at every meal. It's not a small circle because I want it to be a small amount of fat necessarily. I'm not a low-fat proponent. I think that plenty of fat in our diet is important, and we'll talk more about that in week 4. But be sure this week to focus on the protein, carb, and fat section of that plate, which goes right along with your PFC rule. We'll talk more about the veggie section next week. I like the plate method because it gives you a visual when you are dishing up your meals, so you can kind of balance how much of that rice should I take, or how much potato as opposed to the meat or the butter or the vegetables. So you want to try to make it roughly even, the amount of carbohydrate foods with the amount of proteins and vegetables that you're eating. This will help to keep your overall diet pattern pretty low or moderate in carbohydrates, which will help to keep your insulin levels lower. For the course of this program, when we're healing, we do want to keep carbohydrates really nice and low, or at least moderate, as your body fixes the insulin resistance that's going on. There are other things in your life that could be causing chronically high insulin levels besides just a diet that's high in sugars and carbohydrates. So some of those factors might be chronic stress, and those stressors could be emotional stressors or physical stressors like lack of sleep or sickness. It could be inflammation. Inflammation will cause your insulin levels to be chronically higher, and perhaps that inflammation is coming from an infection or another chronic disease that you have. Nutrient deficiencies can also affect your blood sugar metabolism and your insulin levels in turn. And so we want to make sure that we correct any nutrient deficiencies that you may have. Medications can also cause insulin levels to become higher. Certain medications like birth control, corticosteroids, or levodopa could have that effect. And so it's good to understand all of the different sources that could be causing your insulin resistance. We'll be addressing many of these sources of high insulin levels throughout the program. And just know that eventually when you are feeling better and we've addressed a lot of these chronic conditions, it may be fine for you to transfer to a higher carbohydrate diet than we follow during this program. And so we can talk about that later on as you begin to see improvements. Tool number 3 is to limit added sweeteners in your diet and to follow a low added sugar lifestyle. So what does a low sugar lifestyle look like? I like to follow the recommendations from the American Heart Association. They recommend for men 36 grams or less of added sugars a day, and for women and children 25 grams or less of added sugars a day. And there's a graphic in your workbook to help remind you of this. And then there's also a page in there that lists how to spot added sweeteners in foods. So we're not looking just for sugars, but I also count alternative sweeteners as well, because they're not doing you any health benefits either. And so just limiting all forms of added sweeteners in foods is what we're going for here. And keep in mind that we're only talking about added sugars in foods. So it doesn't count if it's coming from, the natural sugars occurring in fruit or milk, only other sources that are being added into the food. And then when it comes to which sweeteners you choose, I do prefer to use the more natural sources of added sweeteners. Maple syrup and honey are my go-tos, because they do have some other health benefits. For example, maple syrup is really high in a lot of different antioxidants. That's not to say that white sugars can't have any place in your diet. We're just looking for moderation here. So in 2014, there was an interesting study published in the Journal of the American Medical Association, the Internal Medicine, and they concluded that getting too much added sugars in your diet significantly increases your risk of dying from cardiovascular disease. They found that those who got 17 to 21% of their calories from sugars had about a 40% higher risk of dying from cardiovascular disease than those that had a low sugar diet. And if you got more than 21% of your calories from sugar, your risk doesn't increase a little bit more, it actually more than doubles. So what does 21% of your calories from sugar look like? So if you have a 2,000 calorie diet, 21% of your calories from sugar would be about 105 grams of sugar. What does the typical American eat when it comes to added sugars a day? So the average for men and women is 96 grams a day of added sugars, and for children it's actually over 100 grams of added sugars a day, which is a lot of added sugars for those tiny bodies. So that puts men and women in, on average, in that 40% higher risk of cardiovascular disease, and it puts our children probably in the double the risk category. You'll find in your workbook a resource for helping you know how to calculate how much added sugars are in your foods if you're making it in your own recipe, and then there's also some label reading activities to help you figure out how to find added sugars in foods that you buy. So the newer food labels that are starting to come out on foods make this really easy, because they actually have a separate category that they're required to list the added sugars in the foods. So look for those newer labels coming out. If you get a food that still has the older label on it, then you'll have to read the ingredient list and look for ingredients that clue you in as to how much of the sugars in the foods are coming from added, or how much might be naturally occurring from fruit or milk. So let's talk for a minute about sodas. Can sodas have a place in a healthy diet? I'll give you some facts and I'll let you decide. So one 12-ounce can of soda, depending on the variety, is going to contain about 40 grams of sugar. So just a can of soda actually puts you above the recommendations for an entire day of added sugars, which is 25 for, again, for women, 36 for men. So a can of soda has 40. If you go with the 20-ounce bottles of soda, that has about 65 grams, which is roughly double the recommendation. And the 1 liter bottles of soda have 108 grams of sugar, which, if you remember, around 105 grams of sugar would more than double your risk of dying from heart disease. And then some of the fountain drinks actually get even bigger than that, and so those can contain up to 128 grams of sugar in the large fountain drinks. Rule number 4 is exercise, which you already began last week. And the reason exercise is a tool for blood sugar control is because your body is actually able to, your cells are actually able to take up blood sugars when you exercise, even if they're insulin resistant. So, and the effects of this last for hours after you've stopped exercising, which is great for blood sugar control. Another reason why exercise is an important part of this program, though, is because exercise is a great stress reducer and a great anti-inflammatory. And when you are lowering stress and inflammation, you're going to be lowering insulin levels as well. And also, we're dealing with chronic disease here and healing chronic disease. And so stress and inflammation in your body are really key parts of all chronic disease. So whenever we can be lowering inflammation, that is going to be really helpful for healing chronic disease. So those are your 4 tools for balancing blood sugars and reducing insulin resistance. So we're going to be building upon last week's concepts by practicing PFC times 3, the plate method with a focus on protein, fats, and carbs this week, and then also practicing a low sugar lifestyle, and then continuing your exercise program. I hope the information in this video was helpful to you, and also be sure to check out all of the additional resources that I've listed in your workbook. You're going to learn so much from them, and it will help you to really understand and take charge of your health moving forward. Good luck as you begin to balance those blood sugars this week, and definitely shoot me an email with any questions that you have as you go throughout this week. I want to make sure that you really have a solid understanding of these concepts. So if you don't feel like you totally understand why we're doing this, reach out to me and let me know for sure. So good luck as you go throughout this week, and I will see you in the week 3 video.